I'm Monica Ogutu, KMET Executive Director. I've been with KMET since its inception in August 1996, because at that particular time, most of the organizations, including the Minister of Health, were not very keen in discussing unsafe abortion. While we knew very well it was one of the major killers, and is still one of the major killers of women.
My name is Abunventure Baraza. I work for KMET. I've worked for KMET for the last 6 years as a productive health coordinator. A post-abortion care program is a part of the productive health programs that I coordinate. And this is a program that is aimed at reducing maternal mortality. That is looking at the fifth Millennium Development Goal. As you know, Kenya being one of the developing countries, we still have maternal mortality very high. Mid-level providers, that is nurses and medical assistants, were not allowed to give services to patients who had abortion-related complications. KMET as a program came up with the vision of training the mid-level providers in management of post-abortion care programs.
Comprehensive post-abortion care is a package. It starts from the emergency management of abortion complication. It also includes accessing contraceptive methods, all methods. We want the site to be integrated to ensure that the woman can access all the methods. It's like a supermarket. It also includes counseling, because most of these women really need a shoulder to lean on. They undergo a lot of stress, a lot of problems, and most of the network members who are offering post-abortion care offer counseling. And the last one is community involvement, because we believe that we need to come together to address the abortion problem in this country. And the community starts from the community of the service providers to the community of the consumers.
KMET works very closely with the Ministry of Health, just to make sure that whatever is doing is accepted at the national level, but also at the national level we have got what we call post-abortion care stakeholders. So probably that's what we do.
The KMET clinic is situated along Nairobi-Kisumu Road. We serve the people we can call that unserved people in the community. We offer different services. We offer curative and preventive services in this clinic. We have lab services. We do HB for hemoglobin. We do RPR, that is to find out if they have syphilis. We also do DTC, and we do PMTCT for the mothers who are expectant. DTC is diagnostic testing and counseling for HIV testing. PMTCT is prevention of mother-to-child transmission. The immunization we offer in this clinic for small children are for anti-TB, anti-measles, for diphtheria, whooping cough and tetanus, for oral polio that prevents polio. Most of the children who are under 5 are malnourished. The children that we find that their upper arm circumference is not up to what is needed, we put them on a feeding program for 6 weeks, and this is called outpatient therapy.
KMET took over the management of the hospital in November 2007. Currently, the hospital has several facilities, both curative and preventive services, maternal child health, imaging or X-ray services, newborn unit, and a community nutrition and home-based care.
We make different type of NutriFlan. We have got the Nene NutriFlan for children. We use it in weaning babies, and especially the malnourished children. And we have got extra, that is for adults.
We have groundnuts, we have sorghum, we have soya, the formulas which we thought we could package and distribute to our clients, people living with HIV/AIDS in the communities. These are communities that are living below $1 a day. They are not able to feed well while they are on very strong drugs. We also work with a network of community health workers. This is a very unique network where you get in the meeting, we have the doctors sitting together with the community health workers discussing the same issues, because the goal is to improve access to quality care to all our patients and clients at home.
Welcome.
We had tons of patients who were being discharged from the hospital when they were still not well because of the congestion in the hospital. We were also faced with another monster, the HIV/AIDS prevalence. So we wanted to offer some care at home. It was a concern of the community health workers. They realized that most of the clients they are serving at home, they were not taking their drugs, especially TB drugs, ARVs, and they were concerned something had to be done. So we trained them also as TB ambassadors. We trained them on another scale. This includes basic nursing skills. We have counseling. We have the skill of feeding a patient, turning a patient, treating pressure areas, and just talking to a patient and making them feel that somebody cares. Another unique innovation, and this is microfinance to save lives, to ensure that we can economically empower our community health workers, including the patients that have recovered. Once they recover, what next?
Kuwa mwaminifu katika ndoa ni kinga pekee, zinazozishinda kondomu zote zinazotolewa, dawa ya pekee ya ukimwi.
So in the center we have 3 vocational trainings going on: hairdressing, catering and tailoring. In the vocational classes, they be in the center for 6 months. Thereafter, they are taken for their attachments, and after that, they can go and work, get employed, or have their own businesses over the same.
Dawa ya pekee ya ukimwi, Mungu alisema ndugu sisi kuwa mwaminifu katika ndoa ni kinga pekee, zinazozishinda kondomu zote zinazotolewa. Good.
The main activities at Sisterhood for Change is outreaches, whereby girls, after they have been taught about reproductive health and girls' rights, they go to the community through the outreaches. When we organize for the outreach, for example in the marketplace, the girls leave the center, they go to the market. They organize what we call ice break, whereby they can even pretend they are fighting or they are quarreling over an issue, like maybe somebody has snatched the other girl's husband. This will capture people and they will come, because these are one of the things that makes people so excited in our community. When they have reached the place, the girls are going to perform the skit and they will have a discussion with the people who have just arrived. Sisterhood for Change is a youth program focusing on the teenage mothers and adolescents aged between 13 years to 24 from the 3 slums areas of Kisumu, that is Manyata, Nyalenda and Nyamasaria. The project covers a maximum of 30 girls who are turned to be peer educators and advocates for change in the community. These outreaches are done in the marketplaces, in the schools, in the hospitals, in the prisons for children, and at our center we also do outreaches.
Dawa ya pekee ya ukimwi, Mungu alisema ndugu sisi kuwa mwaminifu katika ndoa ni kinga pekee, zinazozishinda kondomu zote zinazotolewa.